it has been some time since I've done a press conference in regard to COVID, but frankly, based on the questions I've been getting, I thought it was appropriate time to do that and to bring in Dr. Vanderhoff. A lot of things are kind of coming together. The new COVID vaccine is available to the public, and it's been available now for about a week, and I think it's getting out into the retail market. It's also, of course, time for people to get their flu shots. So again, based upon the questions I've been getting, I thought it was a good idea really to get Dr. Vanderhoff here and just to kind of go through some of the questions that I have been receiving. So Doctor, thank you very much for joining us. And maybe if you could just go through and talk a little bit about the new COVID vaccine and who it's appropriate for. And I'll have some questions. What I'll try to do is ask some of the questions that I've been getting from people. But why don't you start off and tell us about the new vaccine and tell us what we should know.
Well, thank you, Governor. COVID-19 really remains a very real health threat. Indeed, we've been experiencing recently a rise in COVID-19 cases, along with some increases in COVID hospitalizations. Now, we're, of course, grateful that these increases haven't approached the levels of past years, but that's likely due in no small part to the hybrid immunity that many of us have developed as a result of vaccination in combination with past COVID infections. That said, our recent increase in cases and hospitalizations really just reaffirms the importance of staying up to date with vaccination. Now, earlier this month, the U.S. Food and Drug Administration approved the use of a new COVID-19 vaccine designed to target some of the more recent Omicron variants that have driven cases right here in Ohio. The CDC has recommended this new vaccine for anyone 6 months of age or older who has not received a dose within the past 2 months. But this new COVID shot is particularly important for those who are 65 and older, as well as those who are immunocompromised or have serious underlying chronic health conditions, because these Ohioans are the ones who continue to suffer the largest burden of severe illness and death from COVID-19. But the new vaccine is now available, although following the end of the federal public health emergency in May, providers are ordering that vaccine directly from the manufacturer, just as they do other vaccines, rather than through federal and state authorities. Now, if you have medical insurance, and that includes Medicare or Medicaid, these vaccines should be covered as a preventative health service, which means you'll likely have no out-of-pocket costs. Those without insurance can take advantage of several programs to ensure they also have access to the vaccine at no cost. For example, the Federal Vaccines for Children program that allows ODH to offer vaccines free of charge to eligible children, including those who are uninsured, will be available through our network of VFC providers. And for adults who are uninsured, the CDC has created a bridge access program, which will be in effect through the end of 2024. As part of that program, the CDC has contracted with CVS, Walgreens, and eTrue North pharmacies to offer free COVID-19 vaccinations to the uninsured. And lastly, on the new COVID vaccine topic, if you are seeking to find providers who are offering the new COVID vaccine, you can visit the CDC's website, vaccines.gov. There you can filter your search by where you live, your age group, and even if you want access to the vaccine through the new Bridge program, you can also call their number, which is 1-800-232-0233.
Doctor, let me thank you for that succinct answer. People have asked me, okay, I've had a booster some time ago, or some people have said, I got one shot. Others have said, I haven't got any shots. So what's appropriate now? And I think one of the things you told me this morning when we talked about this was you kind of look at this as, in a sense, starting over as far as the vaccines are concerned. Is that a good way of looking at it?
Yeah, I think that is. And really what the CDC and the FDA have done here is say, we have a new formulation. And this new formulation has real benefits. Anyone 6 months of age or up is recommended to get this. But when we look at the data, it is very clear that population 65 and older, and those who have those underlying serious health conditions and immune system issues, it is especially important for them. The data is really compelling that they need to get out and avail themselves of this protection.
If we look at the last time people had boosters, we had less than 50% of the most vulnerable actually get those boosters. Now we're starting, in a sense, all over again. And so I'm going to ask Eric to put up on the chart something that we will continue to display every week, every Thursday, the number of people who have, with the new vaccine, number of people who have been vaccinated. And you can see the numbers here. And again, the numbers are low, as we would expect, because this has just gotten started. But we break it down not just in the total, which is a little over 87,000, but if you also look below that, age 60. And again, the reason we break it down age 60 and over is that is the most vulnerable population. And that really, I think, in our message today is the main target, those people who are the most vulnerable. And I believe what you're saying is, whether you've had vaccine before, if you've never had it before, if you've had a booster, if you didn't have a booster, this new vaccine is now appropriate for you, no matter what situation you were in. And it's particularly appropriate for you if you have underlying health problems, or if you're 60 years of age and older. Is that a fair summary?
Governor, I think that is an excellent summary. I honestly, I can't add a word to it.
Where does flu come in? People now going in, I assume that they can get in most places, they can get a flu shot at the same time they can get the COVID shot.
Yeah, that's absolutely right. COVID, of course, is not the only serious respiratory virus that we need to be thinking about protecting ourselves from this fall. Last year, as you may recall, here in Ohio, we saw very high numbers of influenza as well as RSV. I think the good news is that right now, the flu and RSV seasons do not look like they've started in earnest yet here in Ohio, but we know that they're both just around the corner. So now is the ideal time to go out and get your flu shot. We have a long track record with these flu shots. We know they make an important difference in helping to prevent serious illness. And you can absolutely get your flu shot and a COVID shot at the same visit. The only caveat is you might want to get one shot in each arm just to try to reduce some of the soreness.
Doctor, to talk a little bit about RSV and who a shot is appropriate for in regard to that. You told me this morning we basically have two categories, one at the beginning of life and one older. You want to explain that to us?
That's absolutely correct. So the third virus that really hits us hard during that fall winter respiratory season is RSV. And as I've shared before, nationally, this is actually the leading cause of hospitalization for our youngest, our infants who are under a year of age. Now, in terms of that population, the FDA has approved and the CDC has recommended a new shot for those littlest ones. The CDC recommendation is that infants who are born during this time frame, shortly before or during that RSV season, who are up to 8 months of age, so newborn up to 8 months, really should get the protective shot against this. Its brand name is Beyfortus. And we're anticipating that those shots will reach providers here in Ohio in the weeks to come. But as you also noted, Governor, RSV can be a serious illness for the elderly, especially those who might be frail due to other health conditions. And there are now 2 vaccines that are approved by the FDA for use in the older population, 60 and older. Now, at this stage, the CDC for that vaccine has recommended that patients have a conversation with their provider to make a decision about whether the RSV vaccine for them is the right choice. So if you're over 60, ask your provider about whether you should get an RSV vaccine.
Okay, so if you're over 60, get the flu vaccine,
Yep.
get the COVID, and talk to your doctor about the RSV.
The RSV option. Yep. And
as an option.
That's
And
right.
for a child, if you have a child from birth up until 8 months, you certainly should be talking to your doctor about the RSV for that baby.
Perfect summary.
You and I looked this morning at the data as far as deaths that are occurring, and we still have an average of 2 deaths a day from COVID in the state of Ohio. And when we look at that, and also when we look at the hospitalization, it's exactly what we would expect. It skews very, very heavily towards those older, certainly over 60, and you get older than that, then the percentages go up as well. And I guess that's just would be one more, we hope, persuasive argument for those over the age of 60 to get the new COVID shot.
I think that's absolutely correct, Governor. When we look at the facts on the ground, when we look at the data regarding who's sick enough to end up in the hospital and who sadly is still dying from COVID-19, that burden rests very heavily upon our population that is 65 and older. And as the older people get, the greater that risk. We know very well from all the data with the vaccines that there is a very significant protective effect from getting a vaccine. And that population is clearly one that will benefit from the new COVID-19 vaccine.
Doctor, I want to go back a moment to availability, and you mentioned a program, Bridge program. You want to explain who that's designed for and what that is?
Yes. So as the distribution and availability of vaccine moved into the more usual commercial distribution that occurs for all other vaccines, the federal government wanted to be very careful, very sure to not have people falling through the cracks. Now, as I mentioned, this COVID-19 vaccine, the new vaccine, should be covered by every insurance program. That's inclusive of Medicare and Medicaid. But there are still, of course, some Ohioans who do not have the benefit of health insurance, but they can also still get the vaccine for free. And that's what this bridge program is all about. And again, if they're wondering, well, where can I go to get that? It's actually one of the searchable functions on the vaccine.gov website. So if that is your situation, go right to that website and search for sites in your area that are offering the vaccine through the Bridge program.
Doctor, let's take another different category. I am in my 10th day after having been tested positive for COVID. Tested this morning, as it was negative. And for those people who have recently had COVID, what impact then does that have on them getting the new COVID shot?
Sure. Well, one of the things to recognize is that when we get sick with COVID, it has a booster-like effect on elevating our antibodies for a window of time. And we're fairly confident that time frame is at least 90 days. It would not be wrong to go out and get a shot once you're no longer in that 5-day post-infection isolation period, the time you really should stay away from other people. But because we know you're getting an antibody boost from the infection, it would be recommended that you hold off till about that 90-day window and then go and get your new COVID-19 shot then. And again, the real reason for that is to give yourself the maximum benefit of that shot.
So actually, my intention was to get the shot this week, and Fran and I actually getting our annual physical on Monday, so I won't get the shot. I'll get the flu shot. Fran will get the flu shot as well as the COVID. So we appreciate you trying to clarify this for us, and why don't we open it up for questions?